Hi there, good evening, and welcome to our third coronavirus special, Facts Not Fear, Your Questions Answered. We will answer as many of your questions tonight as possible, many of them focusing on the crisis facing the healthcare industry and just how all of this is affecting all of our mental health. As we take social distancing to heart, tonight we are coming to you from two different locations. I am in the studio right now all by myself. In fact, only a few people here at the station right now, but as you can see, my colleague there, Joyce Taylor, coming to you remotely today. And Joyce, they've set up an entire mini studio in your home, right?
It's been an interesting couple of days. Hi, Jessica. Hi, everybody. So you're right. We transformed this room into a working studio over the last couple of days. It's kind of been a whirlwind. So the crew's been out here trying to make this space work. And I just want to show you what they've been doing. Let's take a look at some pictures of the last couple of days. So this was my husband's office. And now it's basically my TV home studio, my home away from my home team. I miss you guys. So lights, cables, cameras, the works. A huge thanks to our tech team for making it possible. But I have to say, I am very, very happy tonight to be able to say good evening to all of you. I've missed you all. We have a really great lineup of guests for our special tonight. They include the Executive Director of Seattle Anxiety Specialists, the CEO of the Washington State Hospital Association, the Executive Vice President of a major healthcare union, two people at the head of Evergreen Health, the hospital, as you know, at the forefront of this crisis in our country, and also Seattle Mayor Jenny Durkin will be with us tonight. So our first guest is Cassie Sauer. She is the CEO of the Washington State Hospital Association. This group represents all of the 115 hospitals across the state of Washington under a lot of pressure right now, as you can imagine. So our first question to her, are the hospitals in danger of running out of beds and exceeding capacity?
At this particular moment, hospitals are not over capacity. We canceled well before other hospitals in the country did. We canceled elective surgeries in many hospitals. And I would say elective doesn't mean it's optional. It just means it's not urgent. So people are having even cancer surgeries delayed right now, which is a really significant issue. But so we've been able to create a lot of space in hospitals. We've also been asking the state to help move patients out who don't need hospital care any longer. So these may be patients with mental illness or developmental disabilities. But we don't know. What we don't know is who's coming next. We don't have a clear line of sight on how much the disease has spread, how the social distancing has helped, and what's coming around the pike. So there is a danger of running out of beds, and we are not there now.
Our next question, what's the plan if our hospitals do become overwhelmed and they do exceed capacity?
We are planning for the worst and hoping for the best. We don't know whether we will become over capacity because we don't know how many people have been infected and how many people will need hospital care. A lot of it is thinking about alternate care sites. Where could we move patients to that don't need hospital care? The Shoreline site on the soccer field is a good example of getting something ready for capacity. We've been talking with the military about what kind of field hospitals could come, and I think there'll be some announcements about something like that soon. We tried to get the Navy ship Mercy here, but Los Angeles got it instead. So we've been thinking about what are other ways that we can care for patients, plus just really emphasizing to people that if you have COVID, it doesn't mean you need hospitalization unless you have severe symptoms, and a lot of people can be taken care of at home.
We also asked, if our state does get to the point where hospitals need to implement their crisis response plans and make tough calls about who gets life-saving treatment and who doesn't survive, what's being done to prepare them for those difficult choices?
The very first thing we are doing is doing everything we can to never get to that point. So that's the reason that we're calling on the federal government for resources. We're calling on the communities to contribute personal protective equipment, supplies. We're calling on people to very strongly adhere to the governor's stay home and stay healthy directive. But we've had for years actually in the state, a group of clinicians, physicians, nurses, and ethicists thinking about how do you distribute scarce resources. And a lot of that work has been thinking about planning for an earthquake where you might have 5,000 people injured in the space of 2 minutes. But there if we reach the point where the entire system, and I want to be clear, it's no individual hospital, because the first thing you do is move patients around, spread them among hospitals. So it would really need to be the whole region, maybe even the whole western side of the state, every hospital truly overwhelmed. Then you start deciding about who's got the greatest chance of survival, and the care goes to them.
We also asked Sauer to respond to this question from Katie, a registered nurse in Tacoma. She writes, I would like to know when we'll be getting more personal protection equipment for our healthcare workers in the hospital. One single-use mask allotted for the whole 12-hour shift is not adequate or safe for our nurses. When will our pleas be taken seriously? Who do we need to get in touch with? We needed these kinds of supplies weeks ago.
Yeah. I would say for sure we hear you, Katie. This is something we've been working on very much. We absolutely want there to be more personal protective equipment. We've been asking manufacturers in Washington State who have the capacity to manufacture these to change what they're manufacturing to make masks and other personal protective equipment items instead. We've been trying to gather up the personal protective equipment from the closed businesses like dentists or ambulatory surgery centers. We've been asking community members who may have. There was hoarding in the community of masks about a month and a half ago. That's part of the supply disruption. So if people have them, they really would like them to be contributed back to hospitals. And then the biggest thing is really pushing on the federal government on the national stockpile to have more of that released to us.
So earlier this month, Governor Jay Inslee ordered a halt to non-urgent medical procedures in our state. How are hospitals responding to that? Are there any unintended consequences?
Yeah, they've been canceling a whole lot of services. I think the two big unintended consequences are it's very stressful to patients who have things that they would like to get done. So for sure, stress on patients. But the other big thing that's happening is it's causing huge financial problems in hospitals, because these are often the procedures that help hospitals stay afloat financially. And so they're still carrying all their staff and paying all their expenses, but don't have the revenue coming in. We've had hospitals describe to us, I have 120% of the expense and 50% of the revenue.
So what is the public's role in ensuring that our hospitals do not exceed capacity?
The public's role, I think, is to take the social distancing, stay home, stay healthy order very, very seriously. It does not mean, I've got 3 kids. My kids are not allowed to see any of their friends. It doesn't mean your kids get to see 1 or 2 friends. It means you see nobody. You really stay home with your family, and that's it. Every time you have a contact, you have a risk of spread. Every time you have a risk of spread, then those people have a risk of spread to other folks. You don't go see your grandparents. You don't go visit people who are older. It's just, we need to all be incredibly careful.
Our viewer Renee had this question: why don't our healthcare workers have enough protection supplies to keep them from getting the virus and taking it home to their families?
Big reason we're in this shortage in the first place is because China is the main producer of PPE for all over the world. And China, understandably, kept all the PPE for itself. It stopped exporting. So we saw this huge drop in the supply chain. There's actually 2 reasons. That's one reason. And the second reason is that our public hoarded PPE.
We want to say a big thanks to Cassie Sauer. We really appreciate you taking the time, Cassie. Headed back to the studio now, and Jessica.
Thank you, Joyce. Yeah, a term that you've heard a lot lately, and in fact you just heard it, is the term PPE, stands for personal protective equipment, and is essential for healthcare workers fighting against COVID-19. But supplies, as you heard, are running low. Greg Copeland found a couple of ways you can help.
Protective gear such as N95, respirators, gloves and face shields are hard to come by right now. So government agencies and hospitals all across the region are turning to the community for help. Seattle Mayor Jenny Durkan put out a call to action on Twitter, and the city set up a protective equipment donation site. They're looking to industries that also use this gear, like construction companies, auto body shops, and non-essential medical offices. Now, they can only accept unused supplies in unopened boxes or sealed packages. Go to seattle.gov if you'd like more information. Another resource you can use is getusppe.org. They have an interactive map showing you which supplies healthcare facilities in Washington state need right now and also how to donate. It's important to note that these donations are for certified PPE only, nothing homemade. The CDC says homemade fabric masks should only be used by healthcare workers as a last resort, and that's because they haven't been tested to know whether they offer protection from the virus. To find out how you can help, contact your nearest healthcare provider.
And joining us now virtually is Seattle Mayor Jenny Durkan. Mayor Durkan has been with us every week since we started these specials and has also evolved how we interview her with us. So Mayor, first of all, thank you for being here tonight with us virtually.
Thanks so much for having me, and thanks for what you guys are doing. It's really important for the public to hear all the answers to the questions because these are really tough times for people.
Mayor, we also want to thank you for being flexible as we work with this new technology. So my first question to you tonight is something that we've heard throughout this half hour and in other shows that we've been putting together here at King 5 News about the shortage of PPE. And as Greg just mentioned, you have been calling out on the public to donate personal protective equipment. So I want to know from you at this point, when it comes to our state's shortage of PPE, how large is that gap? Where do we stand right now?
So the good news is we've gotten another shipment to the state from the national stockpile that should help, but we still thought it was really important. There's been such a shortage here that we wanted to go to everything. So our call out was not just to the public, but to a lot of the dental offices and clinics that are closed that have that kind of gear. We also were able to get Target to donate a bunch of gear as well. We've had people come forward. I had one gentleman call me over the weekend who has a company that he was able to locate 100,000 masks to import. So look, we have to keep our healthcare workers safe and our first responders. And they are our first line of defense and the only way we will be successful making it through this. So them having the gear is absolutely critical. We need to cover this gap, and then we hope the supply chain picks up. But we in Washington State and Seattle are not going to leave it to chance. We're going to find everything we can to keep our first responders and our healthcare workers safe.
Having the gear is so important, but I also want to talk to you about having the beds and the hospital capacity to take care of people if this outbreak gets worse. So where are we in terms of that?
I think Cassie Sauer just told you right now, I think we have beds, but we're seeing increasing numbers and both in people with serious infections. One thing I want to really call out is we've had so many people from all sectors come in and try to help us. People from private sector trying to help Department of Health and hospitals create an online dashboard so we know exactly when and where we've got beds, how many of them are ICUs, who needs equipment, who needs workers. We're not there yet, but I think that we know that as bad as it is now and as hard as it has been for many families, it's going to get worse. But if we really do what we have to do, particularly the social distancing and stopping the spread of this virus, we do it because we want to keep our hospitals so they can actually have the capacity to treat anyone who needs hospitalization.
Mayor, speaking of getting worse, we're seeing what's happening play out in New York City. And where are we in terms of that? How far away are we from that point? And also, what do we do to keep Seattle from being the next New York City?
So we're fortunate that, I like Seattle to be in front. I really wish we weren't in many ways one of the first cities to experience this and we could have benefited from others. But because we had some of the best researchers here, we knew that our infections exceeded our case numbers. It's hard to believe, but it's only, February 29th was our first known infection in King County. But because we had researchers, we knew that it was actually bigger than that. And so we started taking steps within days, having people work from home at the city of Seattle and our large companies, and then working with the governor to shut down certain parts of businesses. So we have really ratcheted that up. We don't have enough data yet to know where we are on the curve. We know we're seeing an increase in cases and an increase in deaths. We still suffer from one really big thing, and I want people to know, to be honest with you, we don't have adequate testing still here today. People who need to get tested can't get tested. And because we don't have as broad scale testing, our numbers still aren't reflecting what we think the true scale of this are. So we have to focus on those things that we know for sure. The people showing up in the hospitals who are very sick, the number of people that are mortalities, and plan accordingly. So we know things still are getting worse. We don't know where we are on flattening the curve, but we do know from the data that some of the steps we've taken have significantly reduced the number of contacts people are having from one another. But if I could say one thing to your viewers, I don't care how nice it is outside, do not be outside in groups. Do not be playing volleyball together or having barbecues or hanging out in the park. You need 6 feet distance from people if we're going to stop this transmission. Stay home if you can. And if you're 60 or older or have an underlying health condition, we really need you to stay home, except when you really have to go out for a hospital or to a doctor's visit or for groceries. And even then, if there's errands others can do, only by limiting contacts are we going to disrupt this virus.
Mayor, I want to ask you to explain the crisis response plans. We've gotten some questions about that from our viewers, what exactly that means. You mentioned all that we can do, the social distancing, your plea to make sure that people don't go and gather in parks. But what is the crisis response plan that the community would take if it got to a really dire situation? Can you explain that?
Yeah, so that's a great question. So there's no one size fits all crisis response plan. We have to really look at what we're seeing, the data, and from that, see if we need to turn the dial more. So you've seen us ratchet up pretty quickly the orders coming from the state and the county and the city to really cut off those contacts we're having with one another. And I think some people maybe didn't take it as seriously or didn't understand it. It's really simple here. It's as primitive as you can get. There is no cure for this, and there's no prevention. The only prevention we have is our behavior, and that means we've got to stay away from one another, because for this virus to spread, it goes from person to person. And so the fewer contacts we have, the more will disrupt its ability to double. If we have normal contacts, the virus cases double every 6 days. And so if you have 1,000 cases one week, you'll have 2 the next, and then 4, then 16. And we were looking at a scenario where we thought by early April, we'd have well over 40,000 cases and 400 deaths. We think we are gotten a little ahead of that, but we don't have enough data to know because we don't have the testing. So as your last guest said, we are preparing for the worst, hoping for the best, but hope is not an action. You got to take an action, and that means don't go out unless you need to. Don't go hang out in groups. You may not get the disease yourself, but if you do, you could give it to somebody else. And we really need people to heed the governor's warning. Stay home, stay healthy.
Yes, we cannot say that enough. Stay home. So, Mayor, we got a question from Ron, who's a veterinarian in Tacoma, saying that there's a lot of chatter on social media about states that have compiled a list of professionals like veterinarians to be called upon for disaster response. Are there any current plans that you know of to recruit volunteers with medical backgrounds to help the healthcare community respond during this pandemic?
Yes, I think the State Department of Health and the Seattle King County Public Health are looking at whether at current rates we need to start recalling or having people ready, because we know, because it's in the community, people should understand that we're all going to know people who get this. And sadly, many of us will lose friends or loved ones. But the vast majority of people recover. 97 to 99% of the people that get this virus recover. But we also know, because it's so spread, we're going to have healthcare workers and first responders. We already have in the city of Seattle had both firefighters and SPD people test positive. And then you have to pull others out of service. And so the more healthcare workers that get pulled out of service, the more we're going to need more of them. And we may need more just to meet the increase. So I know that we're looking at the ability to recruit other people. And we're looking for medical teams. When we get these military hospitals, we've asked for them to be fully staffed. So they come with equipment and healthcare staff.
Mayor, I want to follow up on that because, as you mentioned, SPD workers getting sick, healthcare professionals. Obviously, you are here with us providing information to our viewers. It's so essential to have our government employees also safe during this time. So I want to just ask you how you guys are striking the balance and advising other people to strike that balance, right, to keep staff healthy and also be able to respond to this pandemic.
So we've got it. We're doing everything we can to keep staff healthy, and that includes wellness. This is really stressful on everybody, and I'm glad you're going to do a segment on kind of the mental health part of this. But we're changing our practices. The Seattle Police Department is doing its roll calls differently. The fire department is requiring social distancing within the fire stations itself. We in city have most people. We have over half of city employees are now telecommuting. And those that do show up, that have to show up, we're making sure we follow those same public health guidelines. In the mayor's office, for example, most people are working from home, or we're rotating so that we have very few people in as much as we can. And we're having so many meetings now by Skype and Zoom and all the other tools that we can use, because we've got to not only model what we're asking other people to do, us doing our part is going to help slow down this virus.
Just very quickly before we say goodbye, Mayor, how are you doing personally?
You know, I'm doing, what keeps me going is the people of Seattle continue to step up. And I've had the chance to meet with some of the healthcare workers on the front lines and the first responders. And I don't dare get tired, because they're right there on the front lines, as tired as anything but, and they keep going to keep us all safe. And then you've got the private sector and the community stepping up, everything from what I call Operation Betsy Ross, people sewing masks, to people raising $27 million to get it to workers and communities who are hit the hardest. We're all in this together, and it's hard, and I know it's so hard, and so many people have lost their jobs and their businesses, and they don't know what's next. But if we stand together, I do believe that we can come out of this, and we can come out of this stronger. But we've got to lean on each other, and I lean on a lot of people. I have the best team anywhere in the country, and some of the best colleagues at the county and at the state and in public health. So if we had to go first, I feel very fortunate that I did it in the city of Seattle.
Seattle Mayor Jenny Durkan, thank you so much for joining us tonight.
Thanks. Take care and stay healthy, everyone.
You too. Let's get back now to Joyce Taylor at her home studio. Hi, Joyce.
Jessica, thanks. I love what she said about all of us having to lean on each other. Isn't that just the truth? So listen, our next guest is Jane Hopkins, the Executive Vice President of the SEIU Healthcare Union, that's 1199 NW. This union represents more than 30,000 nurses, healthcare workers, behavioral healthcare workers all across the state of Washington. It also represents housekeeping and dietary staff who work at medical facilities. Also, Jane is a nurse. She worked at Harborview Medical Center for 12 years. So Hopkins has been hearing from all kinds of healthcare workers all across the state, and our first question to her was, how are they coping?
People are worried about their health. They're the ones that are looking after these patients with COVID. People are coming through the door. You don't know what they have, and you have to make sure that you have all you need for you to be able to look after these patients. So they're really, really worried right now about making sure that they have all the equipment, all the PPEs for them to be able to look after the patients. So that's the main worry. And also, what happens to them when they have been exposed to COVID? How are they going to be looked after? What's the employer doing to help them make sure that they have time at home to be safe and not having to want to come in because they're not going to get paid when they get in?
Our next question, from a medical perspective, is our state equipped to handle this pandemic?
It's going to be very, very hard to have healthcare workers to be ready and be available for the huge crisis that's going to happen in the state. But I think looking at all the work that we've done together with the governor's office, with the hospital association, that we have the best system out there. We just need to have the equipment. I'm asking everybody that would listen, you need to let the federal government know that we need these supplies. we have to have these supplies. People's lives are at risk every single day. We have to decide every single day whether a patient should have a mask or whether it's the person looking after them. That should not be a choice that people have to make every day.
Hopkins says that her union has been included in task force meetings held by Governor Inslee. She's also been directly involved in talking with officials from the state about healthcare workers and how they're going to respond if the hospitals fill up. Here's what she said about that.
Well, knowing very well that this crisis is going to get worse, and that's part of my job. It's to be thinking about what is going to come next and how we're going to have what we need for our members so they don't have to make those difficult decisions. And we don't want to get there. That's why we're sounding the alarm and saying we need to make healthcare workers a priority. It doesn't matter what. They have to be the priority, because if they don't have what they need, nobody in the state is going to be safe.
Our thanks to Jane Hopkins for taking the time to share with all of us. Jane, thank you. A lot of people have been anxious, even depressed, because of all that has been going on. So next, we're going to be talking to a mental health expert to answer more of your questions. So keep those questions coming. We'll be right back. Welcome back, everybody. So great to have you here to our special coronavirus Facts Not Fear, your questions answered. And you have had so many questions, and we're going to do our best to get to as many as we can. A lot of people have been sending us questions with concerns about the state of their mental health or the state of the health of those they love. So joining us now is Blake Thompson, the Executive Director of Seattle Anxiety Specialists. Blake, thanks for joining us.
Hey, yeah, thanks for having me.
We want to tell our viewers to bear with us. There's a slight delay because of technology, but I know they understand. My first question, social distancing for a lot of people means isolation, especially for seniors, but people who find themselves suddenly alone without being able to talk to other people. What is the impact of that psychologically?
Any kind of change in our life creates stress, and, stress is a huge factor in mental health outcomes. And so, stress is one of the main things that ends up leading to depression. And there are a lot of routes that can take, but, often substance abuse is a thing that's on people's minds right now. I think we're all worried about people drinking more and how that might lead to increases in depression, increases in suicide, and then stress and anxiety lead to increases in impulsive behavior too. So I know like financial planners that I talk to are worried about stress causing people to like impulse sell their stock portfolios at a time that might be really inopportune. Yeah.
When you're talking about increase in stress and substances, I mean, that is real for a lot of people. I'm thinking of the thousands and thousands of parents who are suddenly home with their kids and they're homeschooling, multiple kids in some cases. I know for a fact that a lot of parents have turned to day drinking, even though they know it's not a good idea. So I know you just mentioned that. What is your advice to them, those parents who are suddenly under that kind of pressure?
If you're able to find another outlet for your stress, it's so important to do so. And there are a lot of great stress management tactics. Drops in blood sugar cause spikes in stress, so even just snacking a little bit throughout the day as an alternative can help people calm down. There are great breathing exercises to help people feel less stressed. Like, there are a lot of ways to practice diaphragmatic breathing. For kids, we call it dragon breath. Breathe in through the nose, out through the mouth. Breathe from your stomach. A lot of exercise is super helpful for people. Any way that you can get more exercise into your life during this time, super helpful. But if you're struggling to stop drinking, then reaching out to a substance abuse counselor or a mental health therapist. At this time you can do telehealth sessions over your computer with someone. Super important to make sure you're getting help if you're unable to stop drinking or unable to moderate your drinking.
Exercise, I know, is a big one. My daughter is home from school. She's one of the many students who are now finishing the semester online. She also has an immune issue, and so we aren't letting her go out. She's been exercising every day, whether it's yoga online or going for a hike or getting on a bike downstairs. I'm curious how your mental health profession has changed just over the last few weeks. How has your life and your job been impacted?
Well, almost always we see the patients who come to our clinic in person. And so over the last week, we've had to shift to all teletherapy. And that's been really challenging for us, especially because confidentiality is such a huge part of our work. Doing teletherapy at home when there's kids, when there are partners, when there are roommates, and for patients too, they don't necessarily want their kid or their partner listening in on their session. And so finding a way to have a teletherapy session that feels confidential, that is confidential, can be really challenging. We've had a lot of our clients go out and, talk with us in their cars, which, is a little unorthodox, but, has worked for the time being.
I want to get to a question from one of our viewers in Port Angeles who wrote this. I'm in a high-risk category. I'm 65 and have heart problems. I have no kids. Both parents passed. My wife died 4 years ago. I've been in isolation for a week now. There's nobody around for help. The isolation and the feeling of helplessness is something that many in our state are dealing with right now. What is your advice for people who don't really know where to turn?
Yeah, if you're able to afford getting involved with some teletherapy at this time, it really can be helpful to have somebody even just once a week to check in with. There are a number of online platforms that offer this, and a lot of therapists in the Washington state area who offer video therapy. And even if they didn't offer video therapy before, they now have switched to that. So it can be a really great way to get some of that social connection and process some of the emotions that are associated with this.
My last question, a lot of people are particularly worried about their financial situation and will probably find themselves in a financial crisis. What can you say to them?
In the midst of all of this uncertainty, it's really important to practice good stress management. It's easy to catastrophize. It's easy to think of the worst case scenario. But it's really important to remember, all of the social networks that you have, all of the possible fallbacks that you have, we miss those kind of safety cues. Like if we're on a sinking ship, we might not notice that there are life vests available, or that there's a Coast Guard ship, off on the horizon. We think about, like, I'm about to die. And it's really important in any situation, in any crisis, to try to remember all of the strengths that you have personally, and all of the people in your life that you might be able to turn to, because that community support, is what really gets people through a financial crisis so often.
Blake, I think that's where we'll leave it. I really appreciate you taking the time. Some great advice and tips for people. Blake Thompson, the Executive Director of Seattle Anxiety Specialists. Appreciate it. Jessica, back to you.
Good night.
Joyce, thank you. So even if you can't be in the same room as you just saw there are other ways to hang out with your family and friends. Here's Greg Copeland.
If social distancing makes you feel like you're missing out, unable to hang out with your friends and family, try not to let it get you down. People are finding alternative ways to stay in touch with their tribes. Here are 5 social distancing activities to help get you through these quarantines.
Number 1, host a Netflix party. Synchronize your favorite TV shows and movies, and you and your friends can watch together, but separately via laptop or desktop.
It's the closest thing we have to hanging out right now.
Number 2, get connected the old school way with a pen pal. One program started at Village Concepts Senior Living Facility connects their residents with kids home from school. Number 3, have a virtual happy hour. It's 5 o'clock somewhere. Number 4, just because you're at home doesn't mean you have to skip your sweat session. Seattle trainer Corey Galusha keeps his clients going with personalized workouts based on whatever they have at home or in their garage. Number 5, and last but not least, when in doubt, dance it out. Dancers are staying connected with their community via an online dance day at Westlake Dance Center.
The most important thing to remember is even if we're apart, we're all in this together.
Thank you, Greg. So our next guest tonight is Dr. Jeff Tomlin, the CEO of Evergreen Health, which we are all familiar with, I know, by now. Evergreen Health has been at the forefront of the coronavirus outbreak here in the United States, and as of yesterday, reporting 35 deaths. We asked Dr. Tomlin, what has it been like on the inside of your hospital on the front lines?
It really changed over a period of time. We're about 3.5 weeks into it now, and so the first week and a half to 2 weeks was really first contact with the COVID virus. So it was all about making sure we had all the protective equipment that we needed, making sure the facility had the airflows that we needed, and it was developing policies and procedures for visitation and surgery and all those kinds of things. And so it's changed almost every day, but now we're into this phase where we are, because the surgeries were canceled and most of the population is, we're not coming to the shop or the hospital, so visitation is down. So we're now in this phase where we're taking care of the patients that are coming to us each day, and we're probably admitting 1 to 3 patients with the COVID virus per day. So it's steady but very doable. And we're kind of in this phase where we're gearing up in case there's a big surge of cases that would come in the future.
What if there's a surge in patients or medical facilities in our state have to go into what's called a crisis mode? Dr. Tomlin said that his hospital is preparing to shift its resources and partner with other hospitals to share help. So we asked, what's the likelihood that our state will end up in that worst case scenario situation?
So I think that's the question everybody's asking, and we're hoping that all this social distancing and keeping people away from people is really going to help. You could imagine a number of scenarios, and it looks like we're doing a good job here in the Seattle area for right now, but we're all preparing and thinking about what if it became more like Italy or even potentially what it looks like New York is facing. It's really difficult to speculate on what could happen.
Veterinarians, medical students, chiropractors, dentists, and other medical providers have reached out to us asking about whether they're going to be called on to help hospitals responding to this pandemic. So we asked Dr. Tomlin, are hospitals across the state considering recruiting volunteers to help? Is that even a need at this point?
So again, it depends on how overwhelmed you were. You'd take everybody's help, certainly, if we were that overwhelmed. We wouldn't anticipate getting there. but we are making plans in terms of who and when we would contact people to come in and assist.
We also asked Dr. Tomlin, what does your hospital need to effectively manage what's going on right now? Are you equipped to get a handle on this pandemic?
So currently we're doing fine, and we're trying to stay ahead of PPE and making sure we have enough staff, and we're doing okay for beds. Interestingly enough, because all the elective things were canceled, that has opened up a few beds for us. The one thing I think everybody would like to have more of is testing capabilities. I'm not sure that that's on the state, but I think everybody would hope to have more testing just to have a better idea, how widespread this is. It also helps us do a little bit in terms of managing patients internal in the hospital if we can tell more quickly when we have patients that are positive.
We learned last week an Evergreen Health emergency room doctor who tested positive for the virus was in critical condition. How is that doctor doing tonight?
Sure. Obviously, patient confidentiality is very important in this. He's stable and improving. It is hard when one of your own gets the virus, and so we just hope the best for everybody, and we just constantly go over the things that we can do to protect ourselves and each other. And it's one of those things. It's an invisible thing, and so you can defend against the virus at home or at work, 1,000 times appropriately, and the virus only needs one time to enter. So you just have to be on your game constantly in terms of trying to do the right thing for protection.
Local doctors, nurses, and other medical providers have been writing to us concerned about their safety. Many say that they don't have access to personal protective equipment. We asked Dr. Tomlin what his hospital's doing to protect his staff.
This actually starts well before a pandemic. So you need to be, in most healthcare organizations, do a really good job of training people about how you protect yourself from droplet or isolation or airborne precautions. And so you work on that kind of gear all the time. So in flu season, you were protecting yourselves using best practices from CDC and infection prevention. And so we were already doing that. You should know that when we had our first two patients here, three and a half weeks ago, there were other patients here from Life Care already in the hospital, and we were using precautions even then for thinking they had flu and other things. And so we do that, and then once we know we had that virus, we didn't know as much about the COVID virus, so we actually went to a higher level of care.
Our viewer Sue wrote to us and asked this question: why aren't the staff of all healthcare facilities being tested? If they are asymptomatic, they will transmit it to patients. We asked about Evergreen's policy for testing staff for COVID-19.
Only are testing if you're symptomatic. So if you're having flu-like symptoms and fever, and then the benefit of testing everybody who had no symptoms, you would go through a lot of the testing kits, and right now there's a shortage of those. So we're really testing those that are beginning to have symptoms.
Our viewer Allison sent this message to us saying, I would like to know of a person who has recovered from the virus, how they felt while sick, how long they were ill, what were their initial symptoms, and how they feel now. Dr. Tomlin describes what he's seen among patients inside the hospital.
It's so completely different. That's one of the odd things about the virus, is that some people can have the sniffles and may not even know they have it. And then others are just, completely, they feel like they've been hit by a car and they've got a bad flu for a week or even two. So it's just completely variable in terms of how the disease manifests itself in each patient. But we've talked to people that have recovered from it, and they were home for a week of feeling much like the flu, and then another week of not feeling great, but then we're bounced right back.
So thanks to all of you for your questions. Thanks to Dr. Tomlin from Evergreen Health for answering them. Jessica, back to you in the studio.
And Joyce, as you know, we also talked with the Chief Operating Officer at Evergreen Health, Chris Bredesen. So we asked him, how prepared was Evergreen Health for a pandemic like this?
Before my time, they invested a lot in the facilities, and the nice thing about it is the preparation has allowed us to have a lot of negative airflow rooms, which was an immediate win for us as the place that had a lot of these patients. We were able to convert not just rooms, but whole entire wings into negative airflow. And also our emergency department was designed to have half of it go into negative airflow for patients that were presenting. So that was a big plus in terms of preparation. We also have sent about 20 people per year down to Anniston, Alabama to get the federal training and incident command structure. And so we had a lot of investment over the years in emergency preparedness. And so as soon as this happened, we were ready to set up incident command and deal with the situation. We've had to adapt several times throughout this process now that we're into our fourth week.
Medical experts have told us crisis response plans aren't new for our local hospitals. There have always been discussions about what would happen if there's a surge in patients from events like earthquakes, mass shootings, for example. And we asked Bredesen, in our country, is there a model of an event similar in scale to what healthcare workers are currently preparing for? And what lessons can we learn from that?
Well, a lot of our incident command structure that we have now came after 9/11. So that all agencies are speaking the same language and can coordinate. And so I think 9/11 was really the beginning of our current process for incident command structure and communication. So that's very helpful. As I think about examples in the past, they've been more regional, maybe around a hurricane. I can't think of anything on a national level in my 30 years or so doing this. But the incident command structure is there, and I think it's working where hospitals have an incident command. They coordinate with other hospitals on a regional network. That coordinates with the state and then with the federal agencies.
We also asked Bredesen to respond to a message we got from Jennifer in Seattle. She wrote, at some hospitals, if healthcare workers were exposed to a COVID-19 positive patient prior to diagnosis, the healthcare worker is asked to continue working and self-monitor for symptoms. How damaging is this for the spread of the illness if you can be contagious prior to getting symptoms? And what's the risk for our other patients that we continue to work with prior to getting symptoms?
Well, we have personal protective equipment that was in use before we knew we had a patient. We took more aggressive measures after we knew we had our first COVID positive patient. And so we certainly want people to monitor their systems. In fact, when employees come to work as of March 2nd, on that Monday following our first case, we were doing temperature checks and symptom checks on employees coming to work. And when people were symptomatic, then we made decisions about furloughs and quarantine and that sort of thing.
One of the most common questions during this pandemic is what are the symptoms and when should you try to get tested? And now there are reports out of new symptoms, including taste and smell. But is all that true? Here's Jason Puckett to verify.
There are a lot of headlines right now about the coronavirus causing you to lose your sense of taste, smell, or both. Let's break down what could cause this and whether it's actually happening. Our sources are the American Academy of Otolaryngology, Head and Neck Surgery, ENT UK, and Yukon Health. So Yukon Health talks about anosmia and hypogeusia. Those are the medical terms for loss of smell and loss of taste. They show that loss of taste and smell has been linked to upper respiratory infections. And data from ENT UK, a professional group of ear, nose, and throat specialists in the United Kingdom, show that in about 40% of cases where people do lose their sense of smell, viruses were the cause. They specifically mentioned that older strains of coronavirus account for 10 to 15% of cases. So yes, there's evidence that viruses can and have caused the loss of smell and taste in the past. But is it happening with COVID-19? Well, all the officials we've mentioned believe the answer is yes. The American Academy of Otolaryngology, Head and Neck Surgery have made a proposal to add loss of smell and taste to official symptom lists. And the ENT UK are advising anyone who experiences these symptoms to self-quarantine. It is important to note, this likely won't happen in every case. Data from South Korea shows that about 30% of people who tested positive for COVID-19 had lost the ability to smell or taste. So far, the WHO hasn't added this to their list. Here's Dr. Maria Van Kerkhove with the WHO explaining why.
A loss of smell or a loss of taste is something that we're looking into, and we're looking forward to the results of these early investigations that are being conducted by a number of countries.
So we can verify, health officials in the US and UK believe that the loss of smell and taste can be a symptom of COVID-19, and the WHO is currently investigating. The best advice if you experience this, contact your doctor and consider self-quarantine as an added precaution. With your Verify, I'm Jason Puckett.
Thank you, Jason. And I don't want to forget to say thank you to Evergreen Health COO Chris Bredesen for joining us tonight. Okay, every day researchers are learning more about coronavirus, but there is still a lot of data that we need to understand just what we are up against. An inevitable comparison that we've heard is coronavirus versus the flu. How do they stack up? We looked at data from our own state, and here's King 5's Greg Copeland.
It was a common argument for weeks. The flu kills more people than coronavirus. Even the president has made it. He noted on Twitter earlier this month that the flu killed 37,000 Americans last year, far more deaths than have been reported by coronavirus. But new numbers from the Washington Department of Health reveal a sobering reality. Over the weekend, the state reported a total of 96 deaths related to the coronavirus. Flu deaths are reported weekly, and the latest count through March 14th totaled 86 deaths. Those are lab-confirmed deaths, and it is important to note that number is probably higher because of some people not being tested. Keep in mind the flu season is trending down. They started tracking flu activity on September 30th, so we're talking months of activity. We don't know when exactly coronavirus started spreading, but the first case was not identified until late January. The first death was reported less than a month ago. We're not saying the flu isn't a big deal. The CDC estimates the flu kills between 12,000 and 61,000 people every year. But coronavirus is something new. There's no vaccine like with the flu, no treatment that's proven to work, and it could take longer for you to show symptoms, which could mean you spread it to more people. Then there's this. Doctors, nurses, and healthcare workers are ready for the flu, even on a bad year. But you throw in a new deadly virus on top of that, and it doesn't take much to overload the system. That's why health experts say social distancing is so important. If you stay home, fewer people will get sick, and then there's enough help to treat the ones who do.
Still ahead, how one of our own here at King 5 is dealing with coronavirus. We'll be right back. A member of the King 5 news team learned today that he has COVID-19. His name is Tim Hahn. He's one of our super talented photojournalists, and Tim often works with reporter Natalie Swaby. So Tim wanted Natalie to tell his story.
Hi, Tim.
Hey.
All right, Tim Hahn, you are a member of the King 5 family. You are one of our fabulous photographers, my friend, and I got a text message from you this morning. So why don't we start there?
Yeah, I got my results back. I got tested yesterday morning, and I am positive for COVID-19.
All right, so I just want to know what your reaction was when you actually read that.
Relief. I mean, now I know what it is.
You don't know how exactly you got it, right? Or
nope.
Do you? What do you know?
No, I went into a Walgreens on Friday night to pick some stuff up. A gentleman came in the store and he coughed and then asked the guy at the register if they have thermometers, and everybody in line kind of was like, oh my God, what just happened? It could have been that. It could have been anywhere.
What are the symptoms that you noticed?
So Saturday night, I started coughing a little bit. And kind of concerned coughing, looked at my wife oh, that's different. So I took my temperature right away. It was about 99.8. So not a serious temperature, but I still felt it.
So you've still been working. I've been working with you every day, but we've been practicing social distancing.
Yes.
So, right, we've had using our phones for interviews. You've worked from your home. I've worked from mine. You've been doing all the right things.
The only human contact I've had is with my wife in the last week. Yesterday, she started with low-grade fever, so she does have an appointment with her doctor tomorrow.
What has the doctor told you to do?
They basically said, shelter in place, stay where you are, don't leave, 14 days, wife and dog.
Hi, buddy.
I will play my video games and rest, catch up on some shows. She's a reader, so she's going to be spending lots of money on her ebooks this month.
You decided to share your story. What do you hope people take away from it?
I want people to find comfort in hearing from somebody who is on the mend after this. It was very mild for me, and I'm very lucky, but I want people to know that it does get better, and fight it with laughter, and you'll get through.
So we are thinking of you, Tim, and we want to know that we wish you the best. So take care of you and your family, and just get well and get back to work soon. And also to all of you at home and to our guest tonight, thanks to all of you for joining us. We really appreciate you all taking the time, and we hope that we've been able to answer your questions. From my home to yours, be well, and thanks for watching. Good night. Jessica, good night to you.
Good night to you, Joyce. So great to see you. Thanks again for joining us, and we will see you here on King 5 News, and always king5.com.